Good evening. A senior union official has raised fresh concerns over the new Children's Hospital in Edinburgh, claiming that senior NHS staff have told him it may not be fit for purpose. Tom Waterson said drainage at the building is a more pressing matter than the ventilation issues which saw the postponement of its official opening last month. The Health Secretary says her greatest responsibility is the safety of patients. David Cowan reports.
NHS Lothian is already paying £1.4 million a month for the new Sick Kids Hospital in Edinburgh, even though no one can say when it will be ready to take its first patients. Now, a union official who represents 60,000 health workers in Scotland has raised yet more concerns about the project.
We've been told by senior members of NHS Lothian staff that there is major issues with the drainage. Some say we will wait and see, but we won't actually know until the building is up and running and at full capacity. Others are quite clear that they do not believe the drainage to be sufficient and it needs immediate remedy. Otherwise, it's unsafe.
The Scottish Government has already ordered a full safety review into the hospital, which was built by a private consortium, IHSL. NHS Lothian has said the water and drainage systems will be looked at as a priority. But opposition parties say this is happening on the government's watch, and Health Secretary Jeane Freeman must take responsibility.
I've called on the Health and Sport Committee to look at what's been happening, and I also want Audit Scotland to undertake a piece of work around this as well, to see the sort of contracts and where we've got to today.
It's heartbreaking to think that we have a hospital that might never open because the defects in that building work are so bad and could be so costly to fix. So we don't know these things for sure. That's why Scottish Labour is calling for a full independent public inquiry, because we need answers.
The Scottish Government said today that Jeane Freeman has made it clear that her greatest responsibility is the safety of patients, which is why she delayed the move of patients, staff and services to the new hospital. She'll meet NHS staff again in the coming weeks. For their part, IHSL said the hospital works were signed off by an independent tester in February, and it would help with any modifications that are now required. David Cowan, reporting Scotland, Edinburgh.